Patients at Bhisho Hospital have raised serious concerns about unsafe conditions after storms interrupted water and power supply at the facility. The Eastern Cape Health Department says the situation is under control and that patients were moved to nearby hospitals. We followed up on those claims and found that while patients were moved, some families say they were never told and now face financial hardship trying to visit and collect their loved ones when they are discharged. Sipha Kema has more on that story.
For days, patients at Bhisho Hospital described chaos. No water, power cuts, women in labor, families unable to get answers, complaints poured in, painting a picture of a facility in distress. After the outcry, the Department of Health in the Eastern Cape issued a statement blaming storm damage. They said electricity and water were being restored, generators were in place, and patients were moved to other facilities for safety. We went to confirm if that happened. Patients were indeed moved, but we found some families had no idea where their loved ones were transferred to.
Someone called me to attend to a 13-year-old that had arrived to check on her sister. And the 13-year-old came on instruction of their mother because as the family, they are unaware that the patient has been moved to a different hospital.
Anna Apleni is one of those parents. Her pregnant daughter was admitted at Bhisho Hospital. She says she was never told her child had been transferred. Anna provides for her family by selling food. Now her biggest fear is money. She says she cannot afford the multiple taxis needed to reach Mdantsane or bring her daughter a newborn home. Her daughter also has no money to return to Etembeni village outside Qonce. Transport costs are not the only concern. Nurses warn that some hospitals receiving patients are already under pressure.
I just got contacted this morning by one of our members, as I am a shop steward of Dinosa, and then they said that the patients from Bhisho Hospital that are coming into our hospital, then you should know that we are severely short-staffed. We are in Cathcart Hospital and we are 5 nurses for the whole hospital. We have a maternity section, we have an emergency section, and we have 2 wards, male and female. Therefore, you should know that these patients that are coming in, this is the burden that we are facing. And I am going to escalate that to our provincial secretary.
The Department of Health maintains that it acted swiftly and that the families were contacted.
The entire Bhisho area was hit by a storm. And that storm then affected the electricity at the hospital as well as the surrounding villages. However, the electricity has been restored. The issue of water is a municipal problem. It is not a health problem. What then happened was that we have in fact JoJo tanks in the hospital, about 10 of them. Currently, 4 of them are full. In terms of the families, we contacted all families of the patients that were there. So we responded very well as a department in terms of that disaster that hit the Bhisho area.
As work continues in order to stabilize Bhisho Hospital, families say the transfers have created new challenges, especially the cost and distance of reaching their loved ones. For Newzroom Afrika on Channel 405, I'm Sipha Kema in Bhisho.